Yeah, no, it's okay. So basically, we're just this is ridiculous. Okay, so on 8th of the 11th, 2018, there was a copy came back to the verbal offer on Out the Blue, which has been weeks and weeks with no response to date by a certain public servant who works. This is United Kingdom Disability People's Rights. I think they might. It's a temporary rejection of offer without dishonour. North Hampshire Adult Social Services, there's a particular department before you get offered any man or woman because of services, and I have not caused any delay, which isn't being implied on the phone today. Not to hang up on the issues, just to move forward, but this needs to be factual evidence. And just get that. Yeah, can you record that? My mate's watching over me tonight because I'm extremely in armour distress by assumption being made on the phone. But I had an independent individual with me witnessing this. Okay. I'm going to check that in a minute. Yeah, so just make that adjustment, please. It's really not very helpful when the only time I have private life friends to do an email is late in the evening out of business hours in the UK. This is repeatedly made in documents and emails, and one was a recorded post to reject an offer of today. I tell you, I have found out yet again what the reason behind this again is on behalf of, in statutory law, housing secure tender. Yeah, thanks. It's going round in circles for 1 year and 4 months. Look back on this channel for subject on housing disrepair and what's behind all this. Throughout this past 1 year and 4 months, I do not need to keep repeating myself to public servants in the job role. Just to assist them, my friend has copied in a document attached by email for me, reference the subject of, and that was dated, when was that dated? I think it was dated October last year, 2017, but amended it for yesterday's date, which was the Thursday, the 8th, 11th, 2018. 2. Female called Sue. I'm not going to say the last information. Female called Elaine. She works in head office Newcastle Housing. 2. A female called, so many, I can't remember. I had to make a note of all this. Diana. She works in housing, employee, in different area. It's known as Peterborough, UK. They all work online now, by the way. She is misinforming constantly these weeks and months since the offer of this, what's called in statute or care, wish a pen would work, Care Act 2014. And I did not like to do this, but I had no choice because I have an assumption being made. It also copied in, which this this first female is a public servant in a job role. She meant well on the phone, but she brought up some information that wasn't correct. So it was trying to correct again verbally. It's a verbal offer, this was. I don't do verbal offers because of my disabilities. And this was to correct her email at 4 p.m. because it's a very short email. I'm not very good at keeping things. There's so much that's gone on, and yet in their computer system, which is known as, in the United Kingdom, every town and city in England is known as, this system I'm about to say is computer software, and it's linked up. So it's called System 1, as you can as in the words, database for all those that are accessing known as adult social care services. It could be different things for different people depending on your circumstances, but the initial first step, so to speak, into their system, especially in my area, is STEPS, whether it's North or South Department. It's like a prevention department, and they do the initial assessments. I've had this before, but this time round it was pure chance. On Tuesday the 6th of that video, 6th of the 11th 2018, I happened to be with a friend's private life help to get to post a important letter. That's all I did, nothing else. And it got to the Department of also, because I had a suspicion this was going on for weeks and months. Also, subject on, they call it OT. If you don't know what OT is, it's known as a community, in statute law, community occupation therapy assessment at the department. And I found out it is, and I'm just going to read out company numbers, because again, these individuals know who I am, obviously, and they quoted, there's female, don't know, I was with an individual that's doing some DIY work for me, and yeah, I'm just trying to get it up, the information. Okay. Conditional acceptance of offer, my counterclaim offer was sent on my behalf. North Hampshire County Council Limited, company number UCO 4071168. Head office CEO's Teresa Grant. Nothing against the lady. Co as the managing director, Catherine Ainshaw. Nothing against the lady. I don't know them per se. In my area, new public building. It's been all over the mainstream media for months. Division called North Hampshire Adult Social Services Care Management, and as I said, the short-term embedment team south or north, and it's just a team employee. I won't say last information. Sent late evening, well, put out of hours, unfortunately. The spelling was a bit wrong, my mate's tired. Reference to recorded delivery, post letter posted. Oh, you put the wrong date. My mate was trying to do this for me. Well, anyway, it was put down as yesterday's date, Wednesday, 7th, but it was actually dated and posted Tuesday, 11th, 6/11, 2018. It went also code to this department. At this area, they have a monopoly of the care homes, day centres, and all these other services, right? So it's called Olympics Care Service Limited. Company house number is UCO 7818958. The proof of the printouts of both companies was sent with the letter to reject the offer on a temporary only basis until the lawful offer to complete statutory offer of a Care Act 2014 and my choices and outcomes and in all the key questions, and still not offered. It's going around in circles. So many emails, it's unreal. But to the offer of replacement of, it's like the thank you for the offer of a verbal offer today, and it was 8/11 2018, yesterday's date, by phone, out the blue, without number of course, because I'm at 3:30 at that time with my friend as a witness to the only phone number I had left to use, and that was on the recorded answer machine as a very urgent message, because what's happened again today, yesterday's date. phone call, voicemail, and that was recorded. By 4 p.m. with half an hour, I'll get the team manager call me back. And it was pure luck and chance that I had this individual present to witness the call. And again, I just stated, well, the fact that this individual was re-implying again an occupation therapy, why I've temporarily rejected, and she was pushing again like a former public servant social worker who left a job on the 31st of 10th 2018. I wasn't aware, and they didn't even offer me. I had to correct them on record because they didn't replace, even inform me. They had 2 weeks to do this, and previous emails knowing what was going on a different subject and the kind offer of that public servant of all these months and weeks of phone calls to another issue I'm constantly dealing with, like thousands of others like the personal dependence that's known as Departments and Pensions, and they completely have not acted upon my additional evidence of medical recorded posts because it's all computerised, and they've rejected all my offer, and that's a subject which I was getting help with. So, on the seriousness of this, today, what's happened, it's put my situation in jeopardy. Only conditional acceptance of the offer is under duress. I have no other option, or family or friends, in the sense of they can't offer the extra task I need. And this is only since what happened to my health. Check my videos of the date lines. Reference the 27th of 9th 2017 ever since. Due to the fact of the unable to manage alone with strangers in my home, and to avoid already on medical records, overwhelming psychological distress, and I didn't abbreviate that because I already have the factual information, the share your data, medical data anyway, on the computer systems these days anyway. And it made it quite clear, the factual evidence of community occupational therapy, and my change in my personal, and I made it quite clear that I was led to believe ever since the offer was mentioned on the 1st of June 2018. And don't forget, I had this sudden reduction in my health last September. When I first made the call, and I asked for help in hospital, and they refused to assist. And my friends are struggling ever since. So I made the call on the 3rd of the 10th 2017 to the first point of access to North Hampshire County Council Limited. They call it Care Management. A male called Ollie took the call, and it was claimed then I meet the criteria for at least the statutory, which I had to learn a lot about all these months, all this time on now, about all the statutory side of it all as well as the contract law, in the best I could to date. I have found out that all the time they know I've been living in unsafe living conditions due to the breach of contract by Home Group Limited in National Health and Safety Standards in the duty of care to repair my wet room. And go back on the channel, you'll see the videos about all that as first-hand knowledge of my truth, if that's on record to date. If I had not been talking to then my daughter-in-law online, social media and streaming live, while she lives about over 100 miles odd away, nowhere near me, and I would not be here today. I owe my life to her. And she called the police, the ambulance services, and they had to break my home to save my life. I wasn't for those services, those individuals that know who they are, I won't be here today. And I thank for those public servants in the hospital that tried to assist me, but it's only the discharge team. I'll find out more how they work now and why I didn't get help. So can't change what's happened and trying to move forward now. I'm not trying to dig up the past, but this individual today has been doing that. She didn't mean any no disrespect on the phone. She just had a job to do because the director ahead of her job's on the line if she don't. And we're trying Sorry about the noise. They're trying to help so many people in my situation with very short cutbacks. There's extreme cutbacks, I should say, in adult social care nationally, not just my area. I found out why, but only because I went to a public meeting and wasn't attended to. I was the only disabled woman there. There's only a public member there in front of all the political representatives and that scrutiny committee meeting they call, and a very interesting people. And then I wasn't aware that there would be the director of Olympus Care Service Limited or the director of Northamptonshire Care Council of Adult Social Care there. And as soon as I raised just on the key questions, 16 questions they were raised to that woman and her colleague, the male next to her, about what they're planning to assist. And it's looking at the subject of housing as well, and assisted living, and the new forward-looking models and what's to try and help, and the privatisation of a certain company and the PF, the private finance contract. I was led to believe that's the reason by people like me what we're going through for so long in the mainstream media as well. I had to claim, it was claimed by this other public servant today on the phone, it wasn't that at all. Well, all due respect to public servant that mentioned that, and if you hear this or play this back, you will know that's not factual, and this email has corrected you on that. And so this is a fact. The email was sent, facts on record, because also Connection, your colleagues, employees who you work with, are being misinformed again by a certain female called Diana, a housing employee, Home Group Limited in Peterborough area. So again, just to assist you, the notice of dishonour and opportunity to cure is reattached to that email sent yesterday evening late, as your email of 4 p.m. in the afternoon made reference to that company and made reference again in non-factual information that the OT community assessment was only for, claimed again, I've had this, and you're not privy to all of these whole year and 4 months emails between the private correspondence between me and these employees and trying to get a remedy before June 2018. I only shared, I'm sure my housing records are being misshared and misinformed, because you are now assisting the National Housing Company in UK in this area, East United Kingdom, solely at the detriment, negative effect towards my statutory law rights in housing, secure tenure, and that's in Housing Act, Statutory Law, Landlord and Tenant, Section 11, 1989, 1988, as well as in contract law. So despite all these previous past offers on the occupational therapy assessments in 2010, when I got one over 2009, become wheelchair dependent 2010, the factual evidence that previous departments, the public sector side of my area, moved offices to the new building where they are now. They formerly had lost my data. It used to be known as Care First Data Records. I like to know where that data is, by the way. And the previous occupational therapy, well, it was also run by, well, it is still NHS England. It's now known as Clinical Clinician Group, CCGs, funding by private medical company and medical equipment at my disability needs. That's how it works now. So that is slightly different funding stream. But how it works, I've had all of these medical assessments, OT assessments. So it's 2010, 2011, 2012, 2013. The last one, especially 2013, was the fact it was only purposely done for this Home Group Limited company and every report was rejected for minor, very minor aids and attachments in my own flat that I rent, and for my disability needs. But ever since as soon as I moved in 2009, secure tender 2010, they wanted me at my own home, and it wasn't as bad disrepair as it is now. That is what is all behind it, and the targeting of the vulnerable disabled people more than ever you can imagine in 2018. There is a new statute law known as the Homeless Reduction Act 2017, implemented 2018, April, and within that there's a section on preventing homeless, and there's 2-line section on disabled people. Well, basically, in a nutshell, to boil it down to ordinary common worded kind of language, I suppose, it's not set out to aid the vulnerable disabled people, whatever age you are. And I do know that they are just working age people that are able-bodied and fit and healthy to rent this home and take my home of 8 years away from me unlawfully. They have to go to the statutory law court in the UK to seek Section 21 notice and have grounds to take me to court to get eviction. A disabled woman in their home with all the medical equipment and care needs I have. They know that there are discriminatory actions constantly. If they were honourable and really wanted to assist me, they would have offered the 6 men I've had during the period of July 2018 and August 2017 and August 2018 of what they could do with the rotted flooring in the wet room, which has now affected the rest of the flooring in my home. And what they failed to do, if there was honourable and really legitimately wanted to do offer repairs and required a lawful offer of, oh, we need to know what your disability needs are, well, they have that on my housing records. And because they wouldn't rent out, it was rented out and advertised as a flat adapted for people with disability needs. Well, somewhere, I haven't got the copy of policy, nothing in writing, nothing to say that this flat was downgraded to general needs. And so they haven't got a ground to stand on. And nor is their team of lawyers in Newcastle head office, the CEO. So I've been trying to adapt this document and all these months and year. And they are in dishonour and breach of contract, and there's a certain clause known as statutory tenancy law, and there's a key section they've breached, and they know the fact that I can see, but they know the fact that my disabilities and vulnerabilities are taken advantage of unlawfully. And this is rife throughout the United Kingdom. And whether people are homeless, people are temporary accommodation. And I offered, and I found 2 accessible places to temporarily move to. And that was October 2017. By November 2017, they rejected the offer. First, they got all the emails to claim they would pay for that accommodation. They would put my belongings in secure lockage elsewhere where it may be. I sought full disclosure of 3 copies of these repair reports so I'd know what's required and whether it's a disability facility grant in statutory law in housing, what's known as. I know how to use that system and what's required. I could have done that all last summer. And even up to last December, no. I had information, it's not to do with that. Yeah, so I've been misinformed. Anything that needs repair, they block me. But everybody, people living around me, they get what they need. So I'm a target unlawfully. Direct discrimination. So all I've done these past weeks and months tried to work with offer of goods and services, which I've been learning about. Section 42, it is like vulnerable adults, how it works now with all public and private companies, United Kingdom. I have done my utmost to be honourable and lawful. But yet, since the death of my family member, July, and the effect of that still, And then on to me in August, they know to rest. I have been hindered by pressure constantly by certain public servants that have not made allowances. No humane allowances for this effect. They just treat me like a blinking robot. And unfortunately, when you have the two rates at the same time, their compassion has gone out the window. I'm trying to move forward, despite everything, because life is short and I'm just trying to see the limitations of what's offered. I do not like sending emails like this. And I know I said that on the phone today. So basically, all I've had to now is she's gone and made misinformation about my character myself again, and I'm trying to be respectful, and I've had to correct her on the point she's made assumptions about me. There was a crime in statute law in this main building where I live on the 14th of the night, it was a Friday, 2018, which I reported, and the previous former social worker knew all about. The effect on me, I couldn't even go to that meeting. Public meeting in a cafe. I have to have a lot of support just to get out my blinking door to go to somewhere I need to go. So unfortunately, this is a stream. Just basically, I can't seem to record things very well. I seem to rather do it live than stream. I need to go to bed soon because it's very late, and obviously I'm not sleeping well because of what's happened just yesterday. No disrespect to those two females. A temporary rejection offer is a lawful ground for that. And by the way, also the lawful grounds never been acted upon by these other public servants, but on the positive note now, the offer, which I thank of, I don't know these females, but there's two females that are being offered as replacement, and there's probably they're skilled in areas I don't know as yet. I forgot to require the advocacy services, which I've had before, and the 2nd November 2018, I was informed that she's pulled out because the funding is not there until there is allocated a social worker. Right. It's already on record why I cannot consent to phone calls but confirm things by email. And they've ignored that again today. So this is why the email's gone off. And the end of the email made it quite clear what was offered by the former public servant, female, social worker. The serious concerns now today, yesterday's letter I've had, reference the withdrawal of all of my disability living allowance because I was bedbound at 9:15 a.m. on Thursday the 25th of 10th, 2018, that I had nobody here to help me. I can't walk, I can't self-care, I can't transfer, and yet the automated computer system, Capita Business Services Limited, assumption presumption, made the fact that I could walk. I didn't turn up for my medical, but it's a home visit. I've had these months and weeks of constant phone calls. A former social worker offer gives them services, make these calls. She's got emails evidence, and so at the end of the email was seeking clarification, a copy of the last email she claimed to have, and but this is why the new offer, public servants, social workers, I don't know, will be required to assist me on making these phone calls. And by the way, it's now gone to I failed to attend, which I didn't, on bed. It's complete discrimination, and now I need to make formal complaints as well in statute law under consideration. Only two sentence of advice, they call it, in my area. They're refusing also reject my emails, reject the reasonable adjustments in statute law, Equality Act 2010, section 2122, to home visit me. I can't just drop into their centres. They're dropping only one centre and wait around. And they got weeks and weeks and weeks of delays. So this is a record of the truth of the facts on record. I've already did a live stream on Facebook today of who I am, and I linked this to my channel, and this is what is going on. And I don't like doing a rebuttal email again, but this is all to do with when suddenly, out the blue, you attend a public meeting and suddenly that director gets on the back of these other individuals behind the scenes. You won't be informed that's what's happened. But if I hadn't had the gumption to go into that public meeting, to those public servants on Tuesday in my area, I wouldn't be here. I wouldn't have that call today. I wouldn't have the other call today. And I had a witness to this conversation, well, not today, yesterday, I should say, because it's now 1 o'clock in the morning. I need to get off now and get some sleep. But this is what happens. And if you don't speak up for yourself, they're going to walk all over you. And this is throughout United Kingdom. It is a postcode lottery. And I just hope now to move forward is not going to be easy. Never is. But I don't know what's going to happen with this capita, because thousands of people in the United Kingdom are going through all this. And they blocked all... I mean, I can't even believe how the computer system can make a decision just like that anyway. So at the end of the email, just basically states, which was said on the phone as well, the verbal offer, counterclaim offer, was I do require assistance because of the disability living funds to pay for me extra costs. On my disability needs are now being withdrawn. So, yes, so it's the stress and the effects of the personal life has not helped, but I've got an email dated. I co-copied this in when my friend had to do the email for me because I'm not very good at all this extra stuff I need to do. So I do try. And it was dated Wednesday, 31st October 2018 at 5:20 in the afternoon. She contacted a guy called Hoot, H-U-G-H. He informed her that their computer technology system at Capita PLC head office, well, one of the offices, the court centre, up in Darlington, United Kingdom, had been down since Monday, the 29th of the 10th, 2018. Well, correction, Monday. We're just checking the diary for when she left. It was down since the 22nd. No, it was down the 29th. We did get the date right. She made, because she was told to ring them back, and she left on the Wednesday. So 1, 2, 3. So before that was the Thursday when she rang me up at 11:30 and I was bedbound still in that morning. My carers had just come in and they couldn't believe, and they had to stay with me all day. I was in major of a stream shock. And that's when everyone else pulled out. And that's when I was meant to have that social worker sitting on a medical. And all this diary is full of dates, times, who was meant to do what. I have a personal journal, but this is a diary of evidence. And I sent on the 20th of the night 2018. Before that date, with the additional extremely private medical report, additional medical evidence, and stated that I'm waiting for allocation of a new social worker, and also this is delaying the offer. And by the way, I did not attend a medical. I was bedbound, and why did you reject? Now I've got to use the complaint in statute law, and in my area I got an email for that finally. It took me forever to find that. And DWP Limited and head office Clacton House. They're in breach of contract, not I. That's also a corporation. Well, in statute law they call it government. Sorry about the noise, I need to go now. Time zones difference here. So if you get to see this, I have no access to extra services because the other so-called welfare rights in statute law, they call it, well, they blanked me since July the 4th. and ever since, all these emails, everything to date. So again, that public servant said she copied in this other lady called Susan, who's a care manager. And there's a blank email of this OT assessment. Now let me just download this. Yeah, Sarah, thanks for hanging on. Oh, was that download? Oh, it's downloaded. Is that an image? Oh, no, I don't want the image. No, it wasn't an attachment. She didn't send the attachment. Okay. We thought this lady had attached. She said, I've also attached a blank document. But when we go to check it, there's just an image. There wasn't a blank document of an OT assessment form in statute law that these public servants use. Not to worry. What they've done at the bottom, they're using this website, www.nass.uk.net, but when you go on it, the company, which I just quoted who they are, they've ceased trading on the 31st of July 2018. That's where everybody started to go on holiday. It's all in the mainstream media and Hampshire County Council. And then also on the 1st of the 8th, 2018, that's when Olympics Care Service Limited took over everything. So, but they're still using the email and they're still misleading. But I'm not going to get in the political side of it all. I've used these local public servants in my area. In Labour, somebody's attacked my character. That's Conservative, I'm not surprised. But again, I think it's karma, pure luck, that happened to be in that public meeting. So, I know it's going to be extremely hard, even more moving on. But all I've done with my friends help today, this email, is just updated them. But now we'll have to be prepared to move. Because either way, I've got to look at sensibly my health and safety. And I know about all these things, not just what's happened. I can't keep dwelling on the past. Anybody out there with joint, physical, medical reductions in your health, don't risk your health or your life, in my opinion. It's very hard to deal with things now when you've already gone through past experiences. And that's the biggest thing that is going to challenge myself. I have a positive note as well to end. But I've actually now got, eventually, a letter at least to use as evidence because of my feet. They got the correct mobile number, and my friend was able to do this online for me. This is weeks ago, I forgot all about it. Basically, whilst on the waiting list, if my feet deteriorate and becomes red, hot and swollen, or a wound is weeping develops, please contact the number. Well, my condition has developed. I couldn't do the drawing properly online. I could only try and put what's wrong with my right foot. I deteriorated my health, and that's a sign of other underlying disabilities. So I have kept up to date my public sector site, NHS Medical, doctors, what's going on. They've also put down this is diabetic high risk foot service. It's pure luck that I saw a video yesterday about this, NHS England, and big shout out to that video by that public funded company, because I now know more how they do this. So I'm classed as high risk because of my mobility disabilities. They put down here, as we will do our utmost to speed their waiting lists of assessments appointments. Again, I would need to see how I don't know where I'm going to be by then, because I will be out my home. I can't live like this over Christmas and the winter time. So this is dated, computer generated on Tuesday. So obviously that was the date when I went to a public meeting. So obviously I'm now working with people to just get a complete, it's going to be review on other subjects and other situations I don't like doing, but I need it. I'd rather have my friends to be my friends now, rather than what they've been trying to do since I reduced my health last year. So my left side of my foot, the toenails on that side is all fine, but it's my right side. There's a complete deformity. And the I have to spell it, I can't pronounce these words. Podiatry. So I don't want my foot amputated, cut off or anything like that, but there's a risk of that happening. I don't have diabetes, but you need to watch your diet and apart from everything else that I'm going through, that's what also I'm doing. So there's my portable medicine container, and I know what's in it, but I need a new one, but at the moment that's temporarily. So I only know these people, anyone going through, I'm going through. And it's worth to research what's high risk foot. So this is more evidence, basically. The appointment letters is helpful to challenge what I've been informed about. So, and at least it's got all how the NHS side and different NHS trusts work. It's what services can be. So it's IT produced, and I just got another. I said to this lady today that I can access all these free referrals I need still because of the living situations I'm in. Good shout out for an individual that's started doing some DIY in my home. That's made me feel so much better. God bless. It's going to be extremely hard, but I sent this 2 days ago as well, and an email 2 days ago. 7th, that was Wednesday's document. Let me check the date. Yeah, that was 7th, and that was sent in the evening for me. To public servants, and again, this is basically the document that having to learn how to do Google Docs, it is very frustrating. So basically, my friend helped to do that document, and basically, again, was sent by, and I'm going to shout out to the website if it helps anybody in the United Kingdom, disabilitylawservice.org. Template letter, and you just amend it. And Section 9, Care Act 2014, it's basically under Section 9. They cannot lawfully stop your offer of Care Act assessment in statute law. So it got amended slightly. And it just gave me a very helpful template letter. The duties and responsibilities of they call it local authorities, county councils. So regards to the legalities of the Care Act, Section 9 places a statutory obligation on all United Kingdom councils for social care or county councils to assess the care and support needs of men and women where it appears they are in need of such care. This was already deemed back on June the 1st, 6, 2018, by the way. The assessment is one based on my well-being, my ability to achieve the outcomes or the criteria, and the outcomes I've already myself had been made clear to individuals before. I require to achieve in day-to-day life, not on other external considerations. Following the requirements and results of the assessment, it is then for local public funded employees to decide whether there is a duty to meet any needs, and where they have been identified after the criteria is whether it's applied or not. It should be. Confirm the date as to date. Had a social worker, previous one I mentioned before, lady. The care management department employees have made a decision as and to what date first-hand knowledge of the truth to replace an offer in replacement female. I believe that my needs are such that the care and support is required, and there can be evidence. This is already evidence-based already. I've already provided underdress only on these daily life effects, which again, how my personal care needs being washed out buckets because there's no use for a wet room. How my evidence are copied to unlawful breach duty of care by this housing company employees who cause additional harm and block my right to lawful repairs, and that's in housing outcome. So basically, this states, unfortunately, since my limitation obviously being run over in 2009 doesn't help, and then it just goes in the template letter. It's quite statutory guidance and statute law, and it's just been amended slightly for one's personal situations, and as part of the obligations of all United Kingdom local county councils, key department employees on the assessment process of all times to be person-centred and should look to support the individual needs in the context of what is important to them. What's important to me now is for those who work with me and not to keep misleading me, which they keep targeting me with different conflicting information. What's important to me is not to have a 40-page document to expect to read I can't comprehend, but a CD easy to read format still not being provided. I know you might think that's minor, but this isn't, because this will help me to work with these individuals to assist me in what I need of an outcome. How assessments are to be undertaken and procedural steps that should be followed. With respect to the Care Act, local authorities in England must ensure a local process, a lawful process by the way, is followed when undertaking a needs assessment for care and support. Now there's a Need Assessments Act 2012. It claims it can be temporarily put on hold to see if there's any early interventions, mainly the word prevention, to receive longer term support. This is what it's been about, and this is what they're trying to stop because of the funding crisis going on. They claimed, oh, that's got nothing to do with it, but I know first-hand difference. I'll go on. This requires that assessments must follow certain substantive and procedure rules. Well, that could be interpreted with different people in the job role. Substance and timeless of the assessment. Assessments must be formed within a timely manner, but unfortunately circumstances beyond my control has happened. I already said about that. The needs of individuals, paying particular regard to the circumstances and urgency of the case. Well, they already knew what my situation was on the 3rd of the 10th, 2017. They're not in urgent to try and assist me at all. So now they're pushing suddenly OT assessments on me very, very quickly. Yeah. But I found out what's behind that is purely on the housing basis, nothing to assist me in my situation. The determination, the local county council must decide whether the man or woman has needs for care and support and assess the individual against the criteria, statutory law, Care Act 2014, and the ability regulation criteria. So the support planning process as well is vital. That's going to be complicated for me. That comes under section 24 of number 3 of the Care Act 2014. Should a local council employee decide that the individual does not have quality needs, ability needs or the criteria, they financially perhaps, reasons, they have to provide you a reason. in writing or email for that decision making in writing. Clearly states that and the obligation to do that. And that's in Section 1, Section 2, Section 4 of the Care Act 2014. To promote the well-being and prevent needs for care and support, to provide information advice relating to care and support, to delivering support service, right? Local authorities, county councils, employees must inform individual, if any of the needs, what it is going to be met and how, whether by direct payment, which past they blocked me for years. And that's what I'm conscious about now. Present the individual will help in deciding how to have their needs met. Yeah. And it can be different in different situations. So I won't read it all. It was sent Wednesday, 7th 11th 2018 in the evening on my behalf as an attachment by email. God bless, keep safe, God rest, take care, and this is a change. Don't know for the better, but I know there's what they're trying to do on a bigger scale, but it's getting extremely late and I've got to go. God bless, signing out. Thanks, very much. Mandy, thanks for coming. Bye.